demos, but before we jump into our demo for today and look at different workflows, it's important to understand the backend systems used by these providers and the source of data that's going to fuel our AI workflows. And we have to begin with looking at the electronic health record systems. And the number one in that list is Epic Systems. Now, you would have heard of Epic if you've been to a hospital and there is a MyChart link that you get. Where either whether you go to a children's hospital or any of your providers, they have a MyChart where you go and look at your, all of your dashboards and all of that good stuff. These guys own about 42-43% of the market share when it comes to electronic health record systems. A close second is Oracle Cerner, but these guys are catching up really quickly. And then you would have also heard of Athena Health. This must be a little bit more familiar to you, especially if you're in the US, because when it comes to Athena Health, the way I remember them is every Friday at 5 o'clock, one of my kids would get sick when they were like a lot younger, and this is where I would have to come and communicate with the doctors. But there was a window between Friday 5 o'clock and Sunday 6 o'clock, when nobody is around, when we would have to go in and look at this system. So I don't have access to any of the electronic health record systems like Epic or Oracle Cerner. But in today's world with vibe coding, if you don't have access, you can just create your own, which is what I did. So I have built a semi decent electronic health record systems using vibe coding tools like Bolt, which I used this time to create the front end. And then all of the back end data is live data that is coming in from Superbase. So, as far as the electronic health record system is concerned, there are different personas that log into this system. You have a physician that is logging in to put in prescription orders or lab orders, look at patient data and lab reports and things like that. Then you have nurses who are monitoring patients in the ER and so on and so forth. You have contact center agents. You have lab radiology people. You have the front desk admin, and the workflow there is completely different, right? I mean, she might be the one scheduling appointments, she might be the one doing the post discharge workflows and so on and so forth. So there are different personas, including the patient themselves. So this is where the patient gets the my chart access through Epic. But we're going to log in using the physician access, and you see that the system is operational. This is a nice little physician dashboard that that I created. All of this data, all of this records are coming from the backend Superbase database. And so, in some of the other videos, we'll look at how do you create the front end and how do you kind of sync up the backend data. There's quite a lot that goes on, especially if you're not a developer. So, here is all of the data. You can see the critical patients, all the schedule for the doctors. This is a doctor's view, right? So they can come in, they can look at any other patients, and they have access right here. So let's pull up one of the patients that we can look at. So we'll look at Michael Scott, who is my favorite patient. And so here is everything there is to know. There's like 10 prescription orders for Michael Scott. Here are all these alerts and allergies, all his vitals, all the medications that he's taking, all the prescription orders, right? So he's taking quite a lot. Here is all the lab orders that have been prescribed for him. Here are the lab results, all the appointments. And this data is coming from the backend Superbase server, right? So this is the database where the patient records are, and each of the records are linked using unique IDs. So this is where I'm pulling in all of the data from. So what we're going to do now is go ahead and place a prescription order for Michael Scott. So here you go. I'm going to go ahead and put the prescription order, and let's give it for metformin since he has type 2 diabetes, and let's do it twice daily, and that goes to CVS Pharmacy in Scranton, Pennsylvania. And let's go ahead and submit the prescription. That should update our database and generate a phone call. All right, so I have a call coming in.
Hello, Michael. I'm calling to inform you that your provider, Dr. John Smith, has put in a prescription order for metformin 10 milligrams with CVS Pharmacy, located at 123 Main Street, Scranton, Pennsylvania. I'm here to answer any questions you might have regarding this prescription. How can I assist you today?
Yeah, I forgot to ask Dr. Smith, how often am I supposed to take this medication?
No worries, Michael. You should take metformin twice daily. One in the morning after breakfast and one before bedtime. If you have any more questions about
Yeah,
your
I
medication,
do. Are there any side effects for this medication?
yes, there can be some side effects. Common side effects include gastrointestinal issues such as diarrhea, nausea, vomiting, stomach pain, upset stomach, indigestion, gas, and loss of appetite. Other common side effects may include dizziness,
Wow,
muscle
that's
pain.
that's a lot.
I understand it can seem like a lot, Michael. But please know that these side effects often subside as your body adjusts to the medication. Taking metformin with meals and starting with a lower dose can help minimize these issues.
Thank you so
Take
much.
care. You're welcome, Michael.
Execute a workflow where our AI agent does a task. So we truly see the nature of agentic AI, right? Where we are asking it to do something and it actually takes some action. So in the previous workflow, yeah, we had an AI agent call us and we spoke to it and it responded to some of our questions, but we really didn't ask it to change anything in the back end. So that's the whole idea here. So in this case, we are going to log in as the admin, as a front desk admin. We're going to sign in, and this is her dashboard. As you can see, completely different than what you saw with the physician dashboard. Here, the purpose is completely different. Her tasks are completely different. She's still managing the same patients for all her doctors, and then she also has to manage the discharges. So that's a completely different workflow, and maybe in the near future I'll do that as well. But her biggest task is, of course, to book appointments, cancel appointments, schedule appointments. So we're going to go ahead and book an appointment. So let's go and let's do that. This time we'll do it for Emily Davis, so we don't keep the same patient. So let's see, if we want to do for Emily, we will do lab results view, and we'll pick another doctor this time. So let's do Dr. Brown. And Dr. Brown seems to be very much available. There's a lot of slots for him. Nobody goes to him. Okay, so 11 o'clock. Let's do 11 o'clock. Describe the purpose. Lab review. And the copay amount is, let's say, $50. She has a bad insurance. All right, so let's go ahead and confirm. And once again, her booking status is successfully saved. And let's go to Emily Davis's backend data. So if I go and check her appointment is now scheduled with Dr. Brown in endocrinology. So what has happened here is this has now triggered a workflow over a different channel. And here is Emily getting an email. So you can see that, hi Emily, your appointment is now scheduled Monday, August 18 with Dr. Brown for the lab results review, and this is your confirmation number. You want to cancel or reschedule, just reply to this message. So I am going to go ahead and take action. So now we'll truly see an agentic AI workflow, right? So I'll say, oh my God, I can't do this. I can't do this appointment. And of course, the AI will respond in kind. I'm here to help. Would you like to cancel your appointment? If so, please provide the confirmation number for your appointment. So now here I also have the capability to tell it to call me, and it will then turn around and give me a call, and then the AI agent would pick it up from there. But in our case, we'll keep it simple. Let's make it actually cancel the appointment. So if so, can I proceed with the cancellation? So let's give it a cancellation number. So here's the confirmation number that it needs. So if so, provide the confirmation number. So here you go. Here's the confirmation number. Paste it. It's pretty big to paste on chat. Okay, so let's see what it did. Has it canceled it? Your appointment has been successfully cancelled. If you need any further assistance, I'm here to help. Let's see. So we're gonna go back here and now go back to dashboard. Let's go to Emily's appointments again and let's see if it actually worked. And so now if I go to her appointments, you can see that the lab results review has been cancelled. So this is how Agentic AI is working in this particular case. So as you saw in the previous two demos, providers can leverage AI agents across multi-channels, whether it's the voice channel or whether it's the digital channel, to implement many workflows. In the previous demo, I showed a workflow originating from the EHR system, which was done manually. Instead of the admin booking the appointment manually, we can use an AI agent that can communicate with the patient and execute this workflow, the same workflow that was done manually, over the phone or through a digital channel. That ways, you don't need to rely on a human agent who's taking your phone only during business hours to book an appointment. Now, I can call in on the weekend, Friday after 5, uh, generally when the need arises, and talk to an AI agent and get this taken care of without having to worry about talking to a live agent. Similarly, if I go back here and look at managed discharge, that's a complex workflow. There are a lot of things that have to happen after a patient is discharged from ER or from the hospital. All of those can also be taken care of by the AI agents. Let's look at some advanced use cases. So let's say if I go here on a patient, let's go back to our favorite patient, Michael Scott. And let's look at Michael's vitals. So here you can see that I have the capability to collect some of this information in the health record systems. Now you see people wearing glucose monitors, blood glucose monitors and such, which are able to report the data almost real time. We can capture all of that data here and then trigger a workflow based on change in those levels. So if someone's blood glucose level is high or very low, workflow can be triggered based on that as well. All right, so those are some of the workflows I wanted to talk about with you guys. I hope you enjoyed the content today, and if you do, then follow me for more.